So JP, I'd love to you to tell me about, or tell people who might be watching this, a little bit about your story.
Right, so I am originally from Brazil, from the southern part of Brazil, a city called Porto Alegre. I graduated over 20 years ago, and I really loved my course. I loved understanding the body and studying it, and I really spent a lot of time trying to learn how to help people. And towards the end of the course, it was becoming quite clear that there are a few missing parts of the puzzle to be able to help someone. And at that time in Brazil, becoming a sports physio was almost like a stamp of that you're a good practitioner. So that was the direction that I was taking. And when I landed in clinical practice, I wasn't just seeing athletes, I was seeing people of everyday life with chronic pain problems and spinal pain problems, and that was a massive gap in my undergrad. So along with a couple of colleagues, we did lots of courses of manual therapy, which was just arriving in Brazil, and it looked like Australia was the feeder of those courses. And we decided to come to Australia, and I came with a really good friend of mine. And at the time, we were deciding where to go in Australia, and I was teaching in Brazil at the time, and I was meant to be teaching on spinal pain, and I didn't have I had more questions than I had knowledge. And I was looking for research, and I came across your research and some other research as well, but it resonated with me the way that was person-centric. And at the time I couldn't really understand the whole article. I needed a dictionary to translate because English wasn't part of my repertoire. And so we decided to come to Perth because we liked the way you were presenting research. And so I remember when I got here, I knocked on your door in your practice, and we left you a letter. And then the next year we started the master's program, which was a wonderful thing to do, and a very humbling situation for us because we didn't know how much we didn't know. And again, it was a great experience of learning. And at that time, my goal was to, I did a sports course at the time, and I wanted to learn manual therapy. But I got in Australia at a time where there was this divide happening. It wasn't just manual therapy. There was this whole thing about, function and learning how the body works and how to get people back to their goals. So we had these two streams during the master's program. And again, when you came in and you were doing the teaching for us, that really resonated with me. And I kept pestering you, and we end up working together. And it's been a journey of over 15 years now, I believe. So that decision of coming to Australia was always with the goal of becoming a better clinician. How can because I felt when I left Brazil and I had all these courses, I have all these tools, but when I opened the toolbox, I couldn't really figure out which tool would I use for that patient. So there's no clinical reasoning. And so I continued working, and when I started working in our practice now, there was a lot of mentoring involved and a lot of watching other people work and being watched in how I worked and getting all these blind spots revealed to me. And the lack of communication skills was a big one that came up. At that point I could speak English, but it was more the communication style and the strategies. So that evolution of my clinical practice really came from having this humbling experience of going back and saying, wow, there's so much that I don't know. This really strong desire of feeling confident in myself that I could sit in front of a patient and have a conversation and get to the place where they wanted to go. And having really good mentors. And I had the privilege of being mentored by you and continue to be mentored by you as I work alongside you. And being able to connect with patients, and to this day, the reason why we're sitting here is this desire to learn, knowing that you don't always know everything, and really respecting what the patient brings into the session and learning from that. So that's kind of my forever learning journey, which will continue on from here to the day that I stop working.
You probably missed a couple of little points in your journey, like you did a PhD, you did your specialization, which are kind of other elements of your learning, right?
Yeah, and I think the thinking there, you're right, thank you. I'm not very good about talking about myself. But during my undergrad, the lecturers that really caught my attention were the lecturers that were working in the clinic and teaching, plus or minus doing research. They're the ones that really got me thinking differently about my practice. And so I was mentored at that stage, and I did a master's before coming to Australia. It was a master's by research, was in biomechanics, again, because there was a big gap in our undergrad. So when I came to Australia, we did the master's, and I finished that, and I wanted to continue that path, because in my mind, you have to do it to know how it's done. You have to teach it to know how the gaps that you're getting from your day to day, and to be able to help someone to move forward. And if you can do research to then test what you're trying to do in the practice, to me, that was a triad that I really wanted for my profession. So that's what I chased. And the first step then was to do the specialization in Australia, which is a really rigorous process over a couple of years. But probably the biggest thing in that process is the mentoring, where you fly around the country and you see patients in front of specialists. They give you feedback. So that whole process was really important for me, and it really changed me as a clinician, because I identified a lot of gaps that I could continue to work. Once that was finished, I was missing the research, going back to the research, and that's where I did my PhD, supervised by you and other wonderful people that I managed to get together alongside me. And that was a very clinical PhD, where we did that case series, really deeply looking at the journey of people going through CFT. So to me, the research was always very meaningful, always clinical. And as a consequence of that, I am now an adjunct at Curtin University as a senior research fellow. So I'm still involved in projects. I'm involved in clinical practice. We are doing teaching, and this is an extension of that triad.